Cigna Corporation, healthcare and insurance industry. Research analysts are Dominila Sobal and Olesya Panyushkina from King's College Alicante, Spain. Company overview. Cigna is a global health insurance company which offers health, pharmacy, dental, supplemental insurance, and Medicare plans to individuals, families, and businesses from all countries all over the world. Adjusted income from operations is projected to be at least $6.95 billion in 2021, or at least $20 per share. Its U.S. medical sector involves corporate and individual medical plans, government solutions such as Medicare Parts C and D, Medicare Supplement, Medicaid. To be precise, Part B covers physician services, some home health services, and outpatient services. Part C covers private health plans that contract with Medicare.
Investment status. Cigna is a buy at a current price $242 with a target price of $390, which is a 61% increase. The three key aspects which will contribute to the increase in share price are: firstly, Cigna has a wide positive economic moat due to its cost advantage arising from economies of scale, high switching costs in medical industry, and network effect. Secondly, growth and profitability. Expected positive growth of the medical insurance up to $4 trillion, where Cigna has a 16% market share, as well as expected growth to other countries and industries, such as pharmaceutics, due to acquisition of Express Scripts. Moreover, this expansion is supported by strong positive cash flow and increasing revenue and profit margin. And finally, vigorous position on the market. Cigna is strongly beating the competition in the financials, risk management, and ESG strategy. This way, Cigna is providing a long-term profitability for the company and positioning itself as a strong player on the market.
Industry analysis. Worldwide smart healthcare industry around the globe is split into a number of regions such as North America, Asia Pacific, Latin America, Europe, and the rest of the world.
Cigna has a strong position on the market, with main advantages including international and operational presence and low costs, and various target segments. Opportunities are mergers, acquisitions, and expansion to mental health services or biotechnology. Some weaknesses are competitive industry and negative publicity, and threats are government intervention, price wars, and COVID-19 continuation. You might also see Project 5 forces, where 5 states for no threats. The suppliers is the weakest chain, but Cigna is working on building a more efficient and stronger supply chain. Economic mode and valuation. Cost advantage. Cigna has the lowest cost in the industry at the current rate 3.5% and is further decreasing them by investing in more effective technology and building a better operation and supply system. Secondly, high switching cost. A high level of bureaucracy, time, and monetary cost should be incurred to change the insurance provider. Therefore, the existing customers are loyal to Cigna. Finally, network effect. Cigna has a high national and international presence and customer base of 180 million patients, with various customer segments. The relative valuation compared to the other companies in the industry shows that the average implicit value is $390, which is 61% increase from the current price. Now let's look at financials of Cigna. As Cigna is already a large-scale company, a stable one-stage growth in revenue and net income is expected. The catalysts are aging population, growth in the number of people with illnesses due to lifestyles, increase in middle-class population due to economic growth, medical inflation, and growth of supplemental areas such as dentistry. Profitability. Right now, operating margin is 5.54%, profit margin is 5.27%, and Cigna has the lowest cost in the industry, as you can see on the graph, which shows the flexibility and adaptability of the company as the number of customers increases every year. Cigna has a rapidly growing positive free cash flow with $9 billion in 2020, and the company plans to generate $50 billion in operating cash flow by 2025. This might be used to outweigh the leverage arising from acquisition of Express Scripts, as well as used for internal growth and share repurchase, as well as dividends. A payout of $1.4 billion in dividends was completed on 23rd of March this year, and the annual dividend yield of 1.65% is expected.
93% of Cigna shares are held by institutions, the biggest BlackRock, around 8%, Vanguard, 13%, Price, T. Rowe Associates Incorporated, which is 8.6%. Cigna's CEO is David Gordani, who in the past 12 years expanded Cigna internationally and directed the company on delivering community impact by making healthcare sustainable and affordable.
The revenue forecast showed that in 8 years, the average revenue of Cigna would be $241.4 billion, with revenue mainly coming from Evernorth, followed by US medical and then international markets and group disabilities and others. Now let's consider Cigna's ECG values. Its score is 11.6, which positions it in the third percentile, and it has moderate controversial levels. Its main target is to reduce the emissions by 20%, energy by 15%, and water by 10%. It also considers health and well-being, environment, and inclusive and responsible business. Cigna shows poor performance only in water conservation, but it plans to reduce water consumption by maintaining performance and maximizing water efficiency through employing smart, efficient irrigation technology. Also, Cigna participates in community investments such as Cigna Foundation, which provides grants to benefit the well-being of community, such as grant for the Water for People initiative, and also it has Healthier Kids for Our Future program. Finally, let's consider the investment risks. First one is Medicare for All. If M for All or any other kind of public system health would be implemented in the US, which is the biggest geographical market for Cigna, then the company might lose a large percentage of market share and consequently profit. Still, only low single-digit risk that this will happen remains. Moreover, by this time, Cigna might differentiate into other services. Secondly, poor reputation. One of the main examples is Deadly Spin by Wendell Potter, a book written by ex-executive who managed the corporate PR at Cigna. However, the book, which was published more than 10 years ago, makes very small, if not none, impact now. Furthermore, the healthcare industry, especially Cigna, becomes even more self-aware and ethical as we described in the ECG section. Finally, the COVID-19 continuation. COVID vaccination and treatment have imposed additional costs on Cigna, which caused the EPS to fall by $1.25. However, the executive expect the negative impact from COVID-19 to fade in 2022, which reinforces the optimistic EPS projection, reaching $43 by 2029. Cigna is an immensely valuable company with strong financial position and enormous base of international and loyal customers. We believe that the share price will increase by 61% or more, especially Cigna being located in healthcare and pharmaceutical industry, which is expected to inflate and expand in the following decade. Thus, as smart investors, we rate Cigna as a strong buy.